1 year after contracting COVID-19, Andrea Cerisa was faced with something she never imagined: prolonged symptoms and a stack of medical bills.
I've seen so many specialists. I've seen multiple of each of those specialists. A lot of them are out of pocket, a lot of them are out of state. I don't have coverage for out of state.
Her COVID long hauler symptoms run the gamut: gastrointestinal problems, brain fog, dizziness, and severe exhaustion, just to name a few. In November 2020, Andrea collapsed at her home in New Jersey. After consulting with doctors, she decided to seek help at a New York City hospital's post-COVID center, specializing in care for COVID long haulers. But it was out of state, where she knew her insurance benefits would not apply.
I knew that that was my only hope to get help. I had to make the decision to either live or die. I had to make that decision, and so it really wasn't a choice for me.
Afterwards, she says she was billed around $123,000 and showed us her explanation of benefits. She told us much of the last few months has been spent on the phone, trying to see if her insurance could make an exception and help cover the cost.
Now it's, okay, what am I going to do about all these bills? And I do. I wake up in the middle of the night and I'm scared.
It's a post-COVID life she never envisioned. A year ago, she was healthy and newly engaged, a dental office manager by day and a singer by night.
I think I'm the person that you would never expect to be in this position. Here I was a year ago, living such an amazing life, but here I am. I can't get out of bed most days.
Andrea is not alone. Amy Watson has struggled with similar symptoms for over a year after contracting COVID in March 2020, and she's created one of the largest Facebook groups acting as a support network for other long haulers, hearing stories of many struggling to pay off COVID-19 medical costs.
The vast majority of us have not been able to work or have had to have reduced workloads or working from home, trying to recover and stay afloat at the same time.
Hannah Lockman is one of them. She's been to the ER a staggering 18 times after struggling with painful post-COVID symptoms, last year owing thousands, even with insurance.
If I try to think about how much it is, I'm not going to be able to handle it.
What's more, she and her husband had to survive on her income alone for a few months after his restaurant job was cut due to the pandemic. We reached out to Hannah's insurance provider from last year. They told us that in 2020, they, quote, waived all member cost sharing and copay for COVID-19. But in Hannah's case, her employer's self-insured plan meant she was responsible for her deductible and coinsurance. While the pandemic medical debt toll nationwide is still unclear, 2020 saw a spike, likely caused by the compounding health and economic crises. Credit Karma reported that medical debt among its members increased by $2.8 billion from the end of May 2020 to the end of March of this year. Another survey by the finance company Access One found that 37% of respondents were concerned they would be unable to pay for medical care in 2021. Economist Matthew Eisenberg says the millions of workers who lost their employee-sponsored health coverage is one factor likely contributing to the spike.
The best comparison here would be the Great Recession back in 2008, right, where we had this huge unemployment crisis. A lot of people lost their jobs and were unable to weather financial shocks. Now, what makes this different is we had a massive economic crisis at the same time as a massive public health crisis.
And while coronavirus testing and vaccines have been made available for free, COVID treatment is much more complicated. At the beginning of the pandemic, some health insurers voluntarily waived costs related to COVID-19 treatment. Since then, though, they've quietly let those waivers expire. On Capitol Hill, Democratic Senators Chris Van Hollen, Jeff Merkley, and Sherrod Brown introduced a bill that would, in essence, suspend debt accrued during the public health emergency. But that bill has been stagnant in the Senate since it was introduced. Democratic Congresswoman Katie Porter has also introduced legislation easing the impact of medical debt on people's credit.
It doesn't seem fair that that would place such a large large factor in determining people's credit worthiness, which can have downstream impacts in people's ability to open credit cards, finance a car, buy a house, et cetera, et cetera.
Andrea's health has completely upended her life, leading to moments like these where her brain fog is overpowering.
My fog is happening. I'm sorry.
Okay. Moments that are still difficult to process.
My brain, that is just so frustrating to me. That's so frustrating to me. I don't mean to be getting upset. I'm sorry. That to me is just devastating. It's devastating.
Andrea's story, however, may be finally taking a turn for the better. After sitting down with Andrea, we reached out to her insurance company for comment on the six-figure number in her explanation of benefits. They declined to comment on her specific case, citing privacy reasons. After we reached out, Andrea was notified that her insurance would in fact cover most of the costs. As of mid-May, Andrea told us that six-figure charge has dropped, reduced to less than $1,000 deductible.
I didn't choose to get COVID, right? So whatever I have to do to get through this, I'm going to do to get through this.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.